Why do so many men overlook the silent symptoms of prostate cancer until it's too late? John, a vibrant man in his late 50s, always considered himself healthy. He was the kind of person who radiated positivity and energy, always the life of the party and a pillar of strength for his family and friends. He exercised regularly, ate right, and rarely saw a doctor. His routine included morning jogs in the park, a balanced diet rich in fruits and vegetables, and an active social life that kept him mentally sharp. He brushed off occasional fatigue as simply working too hard. After all, who doesn't feel tired after a long day at the office? He thought it was just part of getting older. He ignored the slight change in his bathroom habits, attributing it to age. Frequent trips to the bathroom at night became his new normal, but he didn't think much of it. Then came the back pain, persistent and nagging, that he dismissed as a pulled muscle. He tried stretching exercises and over-the-counter painkillers, hoping it would go away on its own. One day, John collapsed at work. It was a moment of sheer panic for his colleagues, who rushed to his aid, not knowing what had caused this sudden fall. The diagnosis was a shock: advanced prostate cancer. The news hit him like a ton of bricks, shattering his world and leaving him grappling with a harsh new reality. The cancer had spread to his bones, explaining the pain he had ignored for months. The realization that his body had been signaling distress all along was a bitter pill to swallow. John's story is, unfortunately, not unique. Many men face similar battles, often unaware of the silent enemy growing within them. Prostate cancer often progresses silently, masking its presence until it has taken root, making early detection crucial. Regular checkups and screenings can make a significant difference in catching the disease early. John's experience serves as a powerful reminder that we can't afford to ignore our body's warning signs. Every ache, pain, and unusual symptom should be taken seriously and investigated. We must learn to listen to what our bodies are telling us and take proactive steps towards our health. By doing so, we can hope to catch potential issues early and lead healthier, longer lives. Understanding the threat. What is prostate cancer? The prostate, a small gland located below the bladder, plays a vital role in men's reproductive health. Prostate cancer occurs when cells in the prostate begin to grow uncontrollably, forming a tumor. This growth can be slow-growing and confined to the prostate gland in its early stages. However, left undetected, it can spread to other parts of the body, including bones and lymph nodes, making treatment more challenging. Understanding the nature of this disease is the first step towards protecting ourselves. Knowledge is power, and knowing the enemy empowers us to fight it more effectively. Whispers of trouble: overlooked symptoms. Prostate cancer is often a silent predator in its early stages, but there can be subtle signs. These signs are easy to overlook or dismiss as minor inconveniences, but they can be crucial indicators of something more serious. Frequent urination, especially at night, can be one of the first signs. This symptom is often mistaken for a normal part of aging or a minor issue, but it can be a red flag. Difficulty starting or stopping urination is another symptom. This can be frustrating and uncomfortable, and it's often ignored until it becomes more severe. Weak or interrupted urine flow can also be a sign. This symptom can disrupt daily life and cause significant stress. Blood in the urine or semen is a more alarming symptom. This should never be ignored, as it can indicate a serious underlying issue. Some men may experience erectile dysfunction or pain during ejaculation. These symptoms can affect relationships and quality of life. Back pain, hip pain, or bone pain can signal that the cancer has spread beyond the prostate. These pains are often mistaken for common aches and pains, but they can be much more serious. These symptoms are not exclusive to prostate cancer and could indicate other health issues. It's important to consider the full picture and not jump to conclusions. However, experiencing any of these symptoms warrants a conversation with your doctor. Early detection can make a significant difference in treatment outcomes. Don't let fear or embarrassment prevent you from seeking help. Your health is too important to ignore. Take action and consult with a healthcare professional if you notice any of these signs. Section 4. The Wall of Silence. Why Men Don't Speak Up. This is a topic that affects many men around the world, yet it remains shrouded in silence and stigma. Why do men often ignore these symptoms? The reasons are varied and complex, but they often stem from deep-rooted societal expectations and personal fears. Many men are simply unaware of the risks of prostate cancer or the importance of early detection. This lack of awareness can be attributed to insufficient education and the tendency to avoid medical checkups. Others may feel embarrassed or uncomfortable discussing their health concerns, especially those related to their urinary or sexual function. This discomfort can prevent them from seeking the help they need. Some men may also downplay their symptoms, hoping they'll simply go away on their own. This tendency to minimize health issues can lead to serious consequences if left unchecked. Fear of the potential diagnosis and its impact on their lives can also lead to denial and avoidance. The thought of facing a serious health issue can be overwhelming and paralyzing. It's time to break down these barriers. By fostering open conversations and providing support, we can help men feel more comfortable addressing their health concerns. Your health is your most valuable asset, and talking about it is a sign of strength, not weakness. Encouraging men to speak up and seek help can lead to better health outcomes and a higher quality of life. Section 5. Early detection, your best defense. The good news is that prostate cancer is highly treatable when detected early. Regular checkups and screenings play a crucial role in catching the disease in its initial stages, when treatment is most effective. Early detection significantly increases the chances of successful treatment and long-term survival. Think of it as routine maintenance for your body, just like taking your car for a regular service. You wouldn't wait for your car to break down before taking it to the mechanic, would you? The same logic applies to your health. Don't wait for a crisis to take action. Section 6. Taking charge, regular checkups and PSA tests. Men over 50 or those with a family history of prostate cancer should discuss screening with their doctor. A simple blood test called the PSA, or prostate-specific antigen, test measures the level of PSA in the blood, which can be elevated in men with prostate cancer. While not a foolproof test, it can serve as an important indicator when combined with a digital rectal exam, where the doctor physically examines the prostate gland for any abnormalities. These tests are quick, relatively painless, and can provide invaluable information about your health. Section 7. Your life, your legacy, a call to action. Men, it's time to prioritize our health and well-being. We owe it to ourselves, our families, and everyone who depends on us for support. Let's break the silence surrounding prostate cancer and encourage open conversations about men's health. Schedule that checkup, talk to your doctor, and encourage the men in your life to do the same. Be proactive. Remember, early detection saves lives and can make a huge difference. Let's face this challenge head-on and create a future where prostate cancer no longer holds the power to steal our lives and our futures. Subscribe now.